So to admit that they need help, whether it's mental health or from a faculty advisor or anyone, oftentimes feels like a defeat. That kind of a thought pattern can create, in a sense, a barrier. And the degree to which that is held and reinforced in their social systems, it becomes a stigma.
I think the two barriers that I see that prevent people from seeking help is, one, admitting that you have a problem, and number two, finding a resource to get help for that problem.
Sometimes it's they don't want to acknowledge that they have a problem themselves. If I'm getting help, that means I have a problem, admitting to oneself. A big one, though, that I've run into is that people don't really have a very good sense of what good counseling, what good therapy is. They have some misconceptions and oftentimes think, well, that's not going to be helpful to me to go in. I think people need to be better educated about that.
Ethnicity sometimes presents a barrier to seeking help in mental health issues. Many times there's certain groups who find that seeking mental health counseling is a sign of weakness, and they'll be hesitant to seek help with a counselor.
I think from a cultural perspective, oftentimes people are a bit hesitant to seek help. They don't understand what the function is, what a counselor does, what therapy is. Perhaps there was none of these roles in their country of origin. They might turn to family or friends for help and be far more comfortable with that than a professional.
The single biggest barrier that we're finding out for students seeking help is the lack of understanding of the counseling mental health system. Many times they think you're going to be hospitalized, you're going to be medicated, and they don't understand that they can come there just to speak and open freely with a counselor.
The biggest barrier to seeking help, I'm beginning to learn more that it's that not understanding what happens. It's that lack of understanding of what happens in therapy and how it can be helpful.